Welcome back to Fox 43 AM Live. Join us now with Dr. Jessica Meekins, an ophthalmologist with Veterinary Health Center. I get that right?
Yes.
Okay.
Great job. Good morning.
That's a mouthful. To begin, thank you. Welcome into the show. And what exactly is an ophthalmologist?
I like to simplify it by calling it an eye doctor for animals.
Okay.
Yeah, so my job is really diverse. It's never the same thing day to day. We do medical and surgical ophthalmology, so that means we manage eye conditions that are curable with medications, and we also do surgical procedures to help correct specific eye conditions, such as cataract and things like that. So,
okay,
yeah.
and so you've got a very important eye exam coming up, specifically for service animals. So how are you and your team involved with that?
Well, we've been participating basically every year since the program has been offered. This year in 2024 will be the 15th year. And what we do is provide complimentary screening eye exams for service and working animals. And so that includes any service animal being owned by someone, a member of the public, and also military and police working animals. Mostly it's dogs that we focus on, but truly any service animal would be eligible. And we perform a complete eye exam so that we can evaluate them for any abnormality that could impact vision and then subsequently cause them to have issues in performing their work.
Of course, and Dane and I were talking to you, earlier about how does an eye exam for a nonverbal patient work?
Is it blurry? Give me 2 barks.
Yeah.
Well, we do have an eye chart hanging in our exam rooms that has, for a dog, a bone and a cat and that sort of thing. But we certainly can't have them tell us the quality of their vision.
That's true.
So we use special equipment that allows us to screen them for abnormalities that we know would be impactful to vision without needing them to be able to verbalize the quality of their vision.
Of course. Probably not going to tell you.
Yeah. Again, part of me was running like, okay, bring a treat out and then see if they just follow the piece of bacon back and forth, up and down. Of course, they might be following with their nose.
Absolutely, that's true. Yeah.
And so how can people make an appointment, and when does this all start for them?
Registration opens at the beginning of April. It's open from April 1st, April 30th. And so each person has to acquire a registration number and then go to acvoeyeexam.org to do so. And then they call the Veterinary Health Center and ask for an ophthalmology screening exam appointment with that registration number, and we'll get them booked.
Okay. Wonderful. So so service animals, like police work, like farm animals, like cattle, dogs, like what's
the range of animals you've worked with?
Right. So mostly we do a couple of different things. We do field trips to KSDS, the service animal campus in Washington, Kansas. We go down to Wichita to help with the military working dogs there at the Air Force Base. We do hope to have a partnership with Fort Riley, which is close to Manhattan, to do both their military working dogs, and they have horses that are in service. And then members of the public who have any sort of requirement for service and working animals due to physical disabilities, as well as we have dogs that are bomb sniffing dogs, cadaver working dogs, all kinds of a variety of different services that they provide. So it's really diverse in terms of who can the animals that can participate.
Very much.
That's so
I understand you teach a little bit, right? What's that like working with the students? Are you showing them how to do all the eye exams?
Yeah, absolutely. So I do a variety of teaching throughout the veterinary program, which is a 4-year program after undergraduate. And most of my teaching is in the clinical year. So I provide the basics on how to perform an eye exam for the equivalent of a primary care veterinarian. So the basic types of eye problems, and then also teaching them how to recognize more complex diseases that would require a specialist so that they know when to refer cases to me for some extra help.
When is it like, nope, this is above my pay grade, I gotta pass that.
Right. Complex things like cataract surgery, for instance, which we do perform mostly in dogs, that requires an ophthalmology specialist. We do a lot of work under the operating microscope because the eye is so small and delicate, and so any procedure associated with that sort of a level of skill and approach requires a specialist.
That is probably going to be so, so key and so clutch for, I'm sure there are many poor people that bring their animals being like, well, I don't know what's wrong with their eyes. And so their primary care vet has to know and has to at least be able to know like when it's time to refer them to a specialist. So that's so cool.
Love it. Well, hey, thank you so much for joining us this morning. It's been a pleasure chatting with you. And of course, everybody, if you want to learn more, you can visit KSVHC.org.